Tepezza is a prescription medicine used to treat TED, no matter if you've had TED for months or years. Tepezza may cause infusion reactions. Tell your doctor right away if you have high blood pressure, fast heartbeat, redness of the face or feeling hot, difficulty breathing, headache, or muscle pain. Please stay tuned for additional important safety information later in this video.
The one thing I wish that people understood about life with the thyroid eye disease is we are people with hopes and dreams and aspirations that can be sidetracked by this very disease. My name is Paris, and I live with TED. I would describe myself as, first and foremost, a mother. I have an amazing 11-year-old little boy. He's been on this thyroid eye disease journey with me for a very long time. In talking about my thyroid eye disease journey, it's been a very long one. It kind of all snuck up on me. I was going through a time in my life where things were kind of up and down all over the place. My doctors who diagnosed me at the time with having hyperthyroidism, and in my case, and the case of so many others, it can lead to thyroid eye disease. Late 2018, early 2019, that is when I was diagnosed with thyroid eye disease officially from an ophthalmologist. The course of treatment that I used at that time was steroids. My eyes were literally bulging, and when I would drive, whether it's to the store or a short distance to try to go to work or anywhere with my son, I would experience a lot of double vision. And that became more pronounced as the bulging became more pronounced as well. I couldn't do the things I love, which was going out dancing, driving at night. My ophthalmologist told me about Tepezza and prescribed it to me. The benefits that my healthcare provider discussed with me regarding Tepezza was that it could help me with the bulging and just the double vision. Some of the risks that were relayed to me were things such as, I could have muscle pain, there could be hearing loss, there could be tiredness. The only side effect that I experienced was that my menstrual cycle stopped for about 5 months and it came back. After completing my Tepezza treatment, I noticed my symptoms, the bulging and the double vision improved and they were manageable. They thankfully have not returned. My diagnosis came at a time where me being a mother was very important to my young child. It meant a lot to me to finish my treatment, not just for my son, but for the dreams and aspirations that I had before thyroid eye disease was such a big part of my life. Having a career, spending time with our children or our child, our loved ones, going out dancing, driving at night, just experiencing life and in full spectrum. Those are things that meant a lot to me, and I couldn't fathom the thought of not being able to enjoy those. The beautiful thing about TED is that the manifestation of the disease is kind of obvious to most of us who have it. There's a large community of us out here with thyroid eye disease, and it just takes a conversation to bridge that gap and feel like you're included in something. One thing I wish that healthcare providers understood about TED is that even though they cannot see all of the manifestations of the disease, that does not mean that it's not there. That does not mean that it's not as serious. So I wish those were things that healthcare providers would be a little bit more educated on so they can educate the patient as well. So we are a part of the treatment process together. Since completing treatment, TED has been a lot different. I could make a lot of decisions without second guessing or thinking about my eyes. Like I live life without worrying and thinking about, oh my gosh, my eyes. When my son told me, Mommy, your eyes look so much better, it really made it all worth it for me. It really, really made the experience something that I feel thankful that I've had.
Important safety information. What is the most important information I should know about Tepezza? Infusion reactions can happen during or within 24 hours after your infusion of Tepezza. If you have a reaction while receiving Tepezza, your doctor or nurse will slow or stop your infusion and treat your reaction. If you have a severe infusion reaction, your doctor may stop your treatment completely. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with Tepezza. High blood pressure, difficulty breathing, fast heartbeat, headache, redness of the face, feeling hot, muscle pain. Tepezza may worsen inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, even if you don't have a diagnosis of IBD before starting Tepezza treatment. Tell your doctor right away if you have worsening IBD symptoms, which may include diarrhea with stomach pain or cramps, blood in your stools, sudden urgency to have a bowel movement, or feeling like you need to have a bowel movement even when there's little or no stool to pass. Tepezza may cause an increase in your blood sugar. Before starting treatment with Tepezza, tell your doctor if you are currently being treated for diabetes, know your blood sugar is high, or have been diagnosed with diabetes. It is important for you to take your treatments and follow an appropriate diet for glucose control as prescribed by your doctor. Tepezza may cause severe hearing problems, including hearing loss, which in some cases may be permanent. Tell your doctor if you have any signs or symptoms of hearing problems or changes in hearing. Before receiving Tepezza, tell your doctor if you have inflammatory bowel disease, Crohn's disease or ulcerative colitis, are currently being treated for diabetes, have been diagnosed with diabetes, or know your blood sugar is high, are pregnant or plan to become pregnant. Tepezza may harm your unborn baby. Tell your doctor if you become pregnant or suspect you are pregnant during treatment with Tepezza. Women who are able to become pregnant should use an effective form of birth control, contraception, prior to starting treatment, during treatment, and for at least 6 months after the final dose of Tepezza. Are breastfeeding or plan to breastfeed? It is not known if Tepezza passes into your breast milk. Talk to your doctor about the best ways to feed your baby during treatment with Tepezza. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. What are the possible side effects of Tepezza? The most common side effects of Tepezza include muscle cramps or spasms, nausea, hair loss, diarrhea, feeling tired, high blood sugar, hearing problems, taste changes, headache, dry skin, ear discomfort, weight loss, nail problems, and changes in menstruation. This is not a complete list of all possible side effects. Tell your doctor or treatment team about any side effect you may have. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information or visit Tepezza.com for more information. Talk to your doctor to see if Tepezza could be right for you.